November is National Diabetes Month, and we're raising awareness about the disease that can affect anybody at any age. With us this morning is the director of the National Institute of Diabetes and Digestive and Kidney Diseases, Dr. Griffin Rodgers. Great to see you, Dr. Rodgers.
Great to see you, and thanks for having me on your show.
It's our pleasure. Let's start with what exactly is diabetes and how it affects someone's body.
Sure. Well, diabetes is a condition in which your blood glucose or blood sugar is elevated, and that elevated blood sugar can damage your blood vessels and your nerves on almost every part of your body. Now, diabetes is a common condition. It affects about 11.5% of the U.S. population. In Alabama, the numbers are a little bit higher. Actually, the prevalence is 15.7%. And so that puts you in a rank of the fourth highest state in the United States. Now, this damage to the nerves and to the blood vessels can lead to heart attacks and strokes and kidney disease, as well as eye disease, as well as periodontal and foot disease. And so many complications associated with diabetes. And unfortunately, diabetes tends to travel with high blood pressure and high cholesterol. And those three together can conspire to further damage the blood vessels and lead to these complications.
You know, here you mentioned Alabama, one of the southern states, seeing a rise in these cases. What's something that our viewers can do right now? Say, I want to start today. I don't want to be a part of any of those health problems you outlined. What would you tell us to do?
Well, number one is, in fact, the theme for this year's National Diabetes Month is take charge of tomorrow, preventing diabetes health problems. And one of the things, if your listeners are in a high risk group for diabetes, then they want to make sure that they check with their healthcare provider to see whether they've been tested for diabetes, and if so, to begin therapy as early as possible. What are those high risk groups? Well, if you're overweight or obese, if you're older than 35 or 40, you're in an increased risk. There are some genetic components to this, so having a family member, particularly a first-degree relative, with a history of diabetes puts you at increased risk. Being physically inactive is another factor that contributes to high prevalence. And being in certain racial and ethnic groups, African Americans, Hispanic and Latinos, American Indians, or Asian Americans, and Native and Pacific Islanders put you at a greater risk. Some of these things, obviously, your age and your family history and your ethnic group, you can't change, but you could certainly change what you eat and how much physical activity you get. So for your listeners that want to begin early, making sure that they're on a sensible eating plan, and if they're overweight, try to reduce their weight by being more physically active. Something you get started even before you have that diagnosis.
Well, Doctor, we appreciate you joining us, Dr. Griffin Rodgers, and hopefully our viewers will take heart to what you're saying. Thanks for being with us this morning.
Thank you. And if your listeners would like to get more information, please have them visit our website at niddk.nih.gov.
Helpful.
And as we head to break, we say good morning. Hello, sir.
Hey.
To the city of Montevallo. That's Orr Park right there.
Orr Park.
This is Montevallo, home of American Village, University of Montevallo, the National Veterans Cemetery. Just a beautiful place down there. Go see Orr Park if you have not.
You hung out there recently.
Yeah, I did. I was downtown.
Yep. And the countdown's on for the start of Market Noel in Hoover. We'll get more on that coming up as well.